Hospital workers have read it, what happens there that's hidden but that we should know about. The reason you might be waiting for ages for a bed might be because the hospital can't find a care home to release a patient to. If the patient is violent or difficult, then many care homes will refuse them. Which means that not only is that person taking up a bed, but also a staff member that needs to supervise them, and even though the patient is fit to be released, the hospital can't if they don't have a care home to go to. I've seen people take up a bed for weeks and months and the staff are simply not trained to deal with patients like that long term. UK. Money is the top priority for most hospitals. The majority of hospitals are very unsafe. Some of the adverse events happening to patients are not reported to family. Doctors lie to patients all the time. The majority of healthcare workers educated and trained during COVID have a lot of gaps in their education and training. The US has some of the worst outcomes in the industrial world. Care is much better 20 years ago, and it will be a very long time before we're able to get back to that. I'm an ICU nurse with 30 years experience. In the US, insurance companies are buying up doctor practices, urgent care centers, minute clinics, surgery centers, and pharmacies. This is centralizing all the profit under an organization notorious for screwing over medical providers and patients alike, and there's a real risk of insurance companies steering their customers towards centers owned by the insurance company without transparency. Hospitals are corrupt enough, but imagine receiving care at one owned by United Health. I am an ICU nurse. I had a patient who was declared brainstem dead. The family did not want him to become an organ donor, so we withdrew treatment. I switched off the ventilator, pumps etc. and extubated the patient. A few moments later the patient displayed Lazarus sign, which is a reflex that causes the patient to raise their arms in the air. I was by no means new to the role, but this really scared me as I had never even heard of it, let alone witnesses it. When nurses, MDs etc. are laughing, joking with each other, it is a coping mechanism. We aren't trying to be rude, we are compartmentalizing the trauma that we see all day every day. If we don't lighten the load, we would cry all day and never come back to work. It's literally the only way to watch a baby die and then deal with screaming Karen next door without punching them in the face. Imagine being stuck in a windowless white environment with bright fluorescent lights, beeping machines, pained moaning, and poop smells for 12 hours. Now do it with less staff than what's required to manage the volume of people. Now throw in 3 years of burnout from the pandemic. Now consider how grumpy and frustrated you would be, and consider what would make you stay in the job. I am not currently a hospital worker, but for a time I did work in one. A certain hospital in NYC had dead mice in the basement for God knows how long, one of which had decomposed to the point that all that was left was just a bit of fur, mostly bones and some orange dust-like powder, the color of rust, which my co-worker had I guessed to be what was left of the organs. As a hospital social worker, a lot of people think home care is going to include an insurance-covered home health aid. There is no such thing. You have to private hire or get sent to a nursing home for rehab. The staff gossiped about all the patients' families. It is easy to get labeled AA, needy or difficult. Bringing in food for the staff goes a long way. You can refuse anything, but please just do it with an informed decision. Don't want your labs drawn at the ass crack of dawn? No prob, but the docs probably won't see you until your labs are back. Don't want your vitals? No prob, but you might not get your 4 meds until I know I won't kill you. Etc. 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 Also, don't be a dick to your nurses. KTHX by the hospital I work at has these big square covers. When I first started, I would see transport staff pushing these things around the halls. I thought they were food trays, or large boxes of hospital equipment. Turns out it's a structured bed cover, so when they are transporting a deceased patient to the morgue, it doesn't look like a person under a sheet. That patient families will do anything to keep the patient alive for their own comfort instead of abiding by the doctor's orders. For example, feeding an intubated patient a hamburger because he's hungry when they're already getting tube fed in order not to interfere with the vent or trot. This has resulted in many patient deaths than you think. Most don't judge as much as you may think. As for myself, a former medical professional, I don't care what drugs you take or how much you drink, I just want the truth so I can provide the best plan of care for you. For example, if you're an alcoholic or addicted to benzos, I need to know to prepare for possible withdrawals that can become deadly. Everything falls on the direct care staff. No housekeeping, guess who's swinging a mop? Nutritional services are short, guess who's handing out trays? Security is short and a patient in psychological crisis is strangling their roommate, guess who has less help intervening? If we are short ancillary staff, then it's just the RNs to pick up the slack. Just because the person seeing you is professional in the room about your weird issue doesn't mean they aren't walking out of there and telling other staff members all about that person that slipped on a bottle and it went in their ass. No names are used to avoid HIPAA violations, but chances are within an hour the entire floor will know about it. A lot of the times we are very friendly and professional with the patient while in the room with them, but as soon as we leave the room we do talks amongst ourselves about what we really thought of you. Very common to leave a room and say to each other, wow, that guy's an asshole, or that wound was freaking nasty, or that guy is super annoying. They're dangerously short-staffed and short-supplied. I shouldn't have to fucking hunt down 4 pumps, and I shouldn't be managing multiple high acuity situations that clearly call for one-on-one management. Patients get charged for top-notch nursing care regardless of the fact that I can't physically provide it due to being one singular person. We actually really care about you. You're a number to us, and when you have an unexpected outcome, we grieve and have to support each other and have care conferences to process our feelings. Sometimes we even need some time off of work to emotionally recover. I never knew how much doctors and nurses really cared until I became one nurse here. The floors are cleaned multiple times a day by EVs, and they're still the grossest surface known to mankind. The nastiest things you can imagine are being tracked everywhere on that unit. Please wear your socks now. Once had a pill accidentally drop and the patient said 5 seconds rule. Hello, no, that's toxic waste now. I work in a large medical pulmonary ICU at a magnet hospital. I put 10 or so patients a span of 3.5 weeks in body bags. If you see us with a flat effect, it's not because we don't care about you, your loved one. It's because we are numb from being emotionally, physically and spiritually drained. Be kind. As an overnight pharmacy technician with 1 pharmacist for a region servicing 5 hospitals, please have more patience. Your patient is important, but we have a couple hundred and we may not be on the ball with your melatonin at 3 AM when we have more pressing matter like a patient coding or some tanking vitals. Addiction by a variety of hospital workers with access to patient medication. I worked for the Ontario Hospital Association for years, and we knew of more than a few RNs and physicians who had been stealing patients' meds. It happens, but when it does the governing bodies need to do more than cover it up. I know one. I used to manage hospital laundry services. Medical waste, body parts, etc. gets accidentally thrown in the laundry more often than you'd expect. Also needles and all sorts of other medical devices and personal items. Once we even had a deceased fetus come through to the sorting facility. How often we have to hide how we are made to feel. Patients blame staff for systemic issues. It's not your nurse's fault the wait time is long, it's not the individual staff that created the big picture issue. Most of us are trying our best in an unappreciated field and are here trying to help. As an X-ray tech, I can't tell you what's wrong if you ask me if I see anything on your X-rays because it's not in our scope of practice, but yeah, we definitely know. And if it's particularly gruesome, we like to show off how pretty our images came out to other techs. Lol. I help patients to the bathroom non-stop all day. The amount of patients that just leave the bathroom without washing their hands is disgusting. If I didn't hear the sink or soap dispenser, your ass is getting led right to an alcohol hand station. There's sex and drama, but not in a Grey's Anatomy way, more of an overgrown high schoolers shoved together in really stressful situations way. And not as much sex as Grey's, though maybe I'm just ugly and not in on the scene. The whole hospital gets sprayed for cockroaches on a weekly basis. Except the cardiac floor, because the manager wants to save money in the budget to bring home a bigger annual bonus. So that's where the cockroaches live. If you sit there on your phone the whole time the mother of your child is in labor such that a nurse has to step in and fulfill the supportive role instead, yeah, everyone knows, and you're getting judged by the whole unit. Family members demanding something be done because they weren't like this before, but you can't reverse 40 years of damage and abuse to your body in a day. Things are going to give out and there's no coming back from it. Sometimes when people die we just put an oxygen mask on them and wheel them through the corridors. Less distressing for other patients and visitors to think they are asleep rather than see a body with a sheet over it. An in-and-out cath on children is absolutely painful regardless of how many of us tell you it doesn't really hurt, it's just a lot of pressure. It hurts. And retracting the foreskin, on boys, to clean also hurts. In the ICU you spend a lot of time keeping corpses alive until their family comes around or their body gives out. Oh, Jesus ain't ready for her yet. Yes, Jesus is ready for her, we're just actively delaying it. Some families reject death so much, they beg the doctors and nursing staff to do life-saving measures on their 95-year-old grandma who has cancer everywhere and is begging for death. It's just unacceptable. Patient's family need to understand that we don't have the time or will to go and get you a cup of coffee or drink at the drop of a hat. There are vending machines in our kitchen, go help yourself. If you're in a hospital with shared rooms, you might have to listen to someone die on the other side of the curtain. Especially if it's an ICU room. This isn't as uncommon as you might think it is. Putting a feeding tube into a 90-year-old demented person should be illegal, but it's not. Sadly, it is a regular occurrence. This is when could and should are two entirely different things. The updates you get from the OR while your family members on the table are BS. The case could be going really bad and the OR nurse will still tell you everything is going great. We don't care what your dick, vagina, boobs etc. look like. I've seen literally thousands and can't remember any of them except for the one guy whose dick tip was touching his knee. You are doing your 90-year-old grandmother a great disservice by making her a full code. She will not survive CPR and her death will be significantly more traumatic because of it. If you come into the ER drunk, there is guaranteed a pool of bets on your blood alcohol level, possibly with odds if there's a pharmacist available to do the math for us. An ambulance ride is not a one-way ticket to the front of the line. You still get triaged and could be rolled right to the waiting room if you're non-emergent. The bathrooms by the admin offices, across from HR, are the cleanest and they're also open to the public. It's worth a trek across, especially at night. Most hospitals are dangerously understaffed and cut from very important areas, such as cleaners. So take that information and do with it as you will. If you register in the ER and tell the triage nurse that your problem is personal, we know you're here because of something genital or anal related.